Well, hi Darren, thanks for joining us. To get us started, perhaps you could tell us a little bit about yourself and the role that you play.
Hello, Paul. Yeah, thank you for having us online. So my name is Darren Hill. I'm the category manager at Vironex. So I've been in the group company for just over 8 years now, and as category manager for the Vironex brand, I get involved in a number of different aspects for the product. So really, it comes down to helping with the strategy and the direction of the brand, and the markets and the fields that we're playing in. The marketing activity is obviously very key. The commercial agreements, sales agreements with our valued clients and prospects, and then also development of the product, which is obviously very critical, along with our internal innovation team. So that's a bit of an overview of what I get involved with, Paul.
It's a challenging job for you, but it's also been a challenging time for the NHS and for the hospitals who've really been up against it in terms of hygiene. You brought a new product to the market to help with that. Perhaps you could tell us a bit about the journey that you've been on so far.
Yeah, thank you, Paul. It certainly has been very challenging times for everybody, particularly the NHS. So in early 2020, we responded to the unfolding COVID pandemic with the development of a product called Ramsol, which is a surface disinfectant product, and was very well received across many different applications and markets in the early middle months of last year. The main markets that really this attracted initially was hospitality, your airport maintenance guys, the facilities management type organisations, schools, other education establishments, parcel carriers were very, very key for us. Also involved in a project for the Welsh Ambulance Service Trust as well, which was a very, very, very interesting one. So the whole system is based on a pre-pressurized canister, which our parent company has been working with in other markets and applications and industries for some time. So we were very fortunate that we were able to pivot and utilize this for this great use. So what kind of happened next, Paul, was Ramsol caught the eye of some healthcare professionals who really were inside the understanding of the challenges that the NHS was currently facing within the hospitals, and saw how our system could really plug the gap that existed with fast, simple, effective, large surface area disinfection. That's the kind of bracket that you can put our product into. So that's where it really raised awareness for the medical clinical space. What we quickly realized was that the Ramsol system needed some refinements to make it more suited to clinical medical environments, and that is where Vironex was born.
So basically, I mean, it sounds absolutely fantastic. So what exactly is Vironex and how does it work?
Okay, so to unpack the product a little, so Vironex is a high-level surface disinfectant spray product with virucidal, bactericidal, and sporicidal efficacy. It's delivered from a 100% portable canister system, which obviously naturally brings immense levels of portability and mobility and ease of use. Vironex holds an impressive array of BSEN standards, which are obviously clearly very important to have a credible product out there in the market. So we cover right through from the BSEN 1276 for your bacteria standards, right through kind of 13697, 14476 stage 1 virucidal, and also onto your 16777. And a lot of these tests have been done under high medical load as well, so they really do have some great results under the belt for the product. It's a spray and leave product, so it's applied to the surface, compatible with both hard and soft surfaces, and it applies a approximately 20 micron droplet via handheld spray gun, which is one of the many really unique parts about the product.
So in terms of that, as we mentioned before, it's been a tough year for hospital IPC teams, for domestic service operators trying to get to grips with these intensive hygiene protocols. So in your opinion, what is this going to mean for those people?
Yeah, I mean, firstly, I couldn't agree more. I've witnessed firsthand how much pressure some of these guys have been under over the last period, and we all acknowledge that. I think what Vironex brings is a very, very agile system, Paul, for surface disinfection. It's always on hand, it's always there, it's ready to go. You know, there are other methods out there that are very, very arduous, very time taking. You get like the mixing of concentrate materials, etc., the associated waste handling that can be involved in some of these systems. So, you know, I think it's just very compact, very agile, and so suited to this environment. You know, the speed that Vironex can really deliver at is very, very critical as well. You know, reoccupation and turnaround times of bed capacity and wards in general. You know, this has been a really challenging aspect. So that's where Vironex can really hit home, and it is such a simple system. Hence our strapline. You know, it's disinfection, remarkably simple, and that's really what it is.
In terms of that then, how has the market responded to Vironex so far? I mean, what do IPC professionals think? Have you had any interest from the NHS or indeed any other health bodies?
So, Paul, yeah, we've been involved with some NHS organisations, and the primary one we've been working with is the board up in the hospital board up in North Wales, the Betsy Caldwell Trust. We've been working very closely with them, and really appreciate the collaboration that we've got with them, the feedback they've given us for developing the product as well. Feedback is very positive at this moment in time from the hotel services teams and the IPC professionals that have been involved with it. I think first and foremost, they've been very impressed. As I've said already, it's just the ease of use of the system. It's so simple, it's so agile, it delivers for them. So it's we're really excited to see where that can go. And it seems like other departments that are not trialing the product are very keen to get their hands on it. So that's always a good sign as well.
So what is the main vision for Vironex then? How do you see this fitting into the future of hospital hygiene, especially in the wake of the pandemic that's still ongoing?
Yeah, no, it's very valid, and really, I think our vision for this product is, again, it's about where it fits in the spectrum of products that are available to these teams. You've got very long-standing traditional manual methods. On the other end of the spectrum, you've got very advanced methods which are out of reach for some people. You know, they do have a lot of other technicalities surrounding them, and Vironex really fits right in the middle there as a system that can deliver with speed and efficiency, easily deployable. You know, just a very agile system, and that's really that's our vision for the system into the service.
It's fantastic news that you're already in trials with the NHS, and I'm sure the results that come back will really be interesting. Will you be able to come back and update us when you've had that feedback?
Yes, certainly, Paul. I think we'd be definitely very happy to do that. We consider it a privilege to be part of trying to bring some solutions to market which can make life easier and bring about better environments in our hospitals, and definitely it would be great to come back online. Obviously, we're looking forward to the event as well, the NOLEX event that you guys are running, which Vironex will be present at, and we can engage with many more IPC professionals regarding this system.
We look forward to seeing you there. We look forward to getting the result from the product that you've actually already got out there with Revolutionised Category. And we look forward to speaking to you again in the not too distant future. Thanks for your time, Darren.
Many thanks, Paul. Goodbye.